HECC do serve the whole student body, and so we do have to make some decisions around treatment that provides the best opportunity to both meet the students' needs as well as be sure that we're available to as many students as we possibly can be available to. And so we don't like to put a specific number that we try to squeeze everybody into. We really like to have you guys come in, meet with one of our clinicians, and develop a specific treatment plan that could be able to be tailored to your particular needs. The process of meeting with a counselor is we have walk-in sessions, walk-in hours that are available Monday through Thursday, most of the day, those days. And what happens is the students just need to walk in. They can fill out a very brief form that gives some indication about what's bringing them in, a little bit of information about who they are. It also gives them the opportunity at that point in time to indicate if they're in some level of crisis so that we as clinicians can know if we need to prioritize those students. But typically for this general student that's just coming in that wants to initiate therapy, they would most likely have a same-day appointment in which they would just walk in, fill out that paperwork, and meet with that walk-in clinician that's available. And those walk-in appointments are typically about 20 minutes or so, in which we're able to gather some very basic information around what is your presenting concern, what type of support do you have, what type of resources do you have any relevant medical or psychiatric history that would be important for us to know. It gives us an opportunity to kind of do a bit of a risk assessment. And then at that point in time, we would go over all the different options that are available to our students that include both individual therapy here, it involves group therapy that's here, some of our different workshops that we have available, as well as talks about some of the differences between providing individual therapy here versus in the community. And then we really try to work with the student in that moment to create a treatment plan for them, to talk about what would be in their best interest in terms of how to utilize all of the resources that are available to them to maximize the benefit.
Sort of interesting. So I have my master's in social work, and I'm actually currently working on my hours towards my counseling license, my clinical license. But on campus, I don't perform individual therapy. I co-facilitate a group once a week. Then I do, but mostly case management on campus. And so that is, it sometimes starts to tread into that like therapeutic realm, because sometimes you're talking to somebody and then you get into some emotions and whatnot that you need to process. But yeah, so it's mostly that case management role.
I think one of the things that can be hard about having a friend that could benefit from therapy but maybe isn't as open to that is some of this perceived stigma around maybe seeking some support. And so sometimes one of the things that can be really helpful is if you even kind of have gone through the process of getting education around what this would look like, what this would be like, what it might feel like. And one thing to even know is that our group therapy options are actually open to any student that is on campus, that's a registered student. And so if you were to see a particular group therapy option that you felt like your friend could benefit from, go with them, bring them along, even if that means maybe walking over during the walk-in time for an individual session to offer to be with them through that. And maybe even offer to kind of go through the process with them in the sense of, I could work on X, maybe we could try doing this together.